Warm greetings to you mommies and daddies. If you have come to Abebe Foundation, then I can assure you that you have come to the right place. Here in this short clip is my miracle baby after 4 years of trusting God. I thank God for using Dr. John the baby and this amazing team of experts to bless my family with this pretty angel. And I am certain and sure that God will use them to change your titles to mommies and daddies in Jesus' name. Amen.
Ọba lábí àsásí abiyamọ kíka tí wéré Elédùmarè ọba tó ga jùlọ foundation tó solé ayé ró foundation ìgbàlà mi mo dàgbé kọrùn fún bàbá tí ìṣèkẹ́ mi kábíyọ̀sí.
Ọlọ́wọ́ gbọ̀ngbọ̀rọ̀ is turning things around. Ọlọ́wọ́ gbọ̀ngbọ̀rọ̀ is turning things around. Ọlọ́wọ́ gbọ̀ngbọ̀rọ̀ is turning things around for my good. Yeah, for my good.
Break every chain. Somebody raise up your voices and the most total, and you declare that the chains are broken. The chains are broken. The chains are broken. The chains are broken.
What do you see?
A girl
resources. And we also like to thank Joji and staffs. Thank you, Dr. John Abebe and team, for helping us through this journey. We wouldn't have gotten through it without you. Thanks for all the care and love. Thanks for making our dreams come true. You all are simply amazing. Courtesy, Mr. and Mrs. Abiola.
Wow. What a choice. Wonderful.
Okay. Good afternoon, ladies. How are we doing? Welcome. So, how have we been doing? We're doing well? Okay, that's good. Welcome. All right, so good afternoon, ladies. No, there are no gentlemen in house. So let me say to gentlemen out there who are joining us online together with their wives, good afternoon, and you're welcome to today's antenatal class for the month of November, powered by the Joje Hospital, the Joje Center for Women's Health. All right, so today we'll quickly briefly go through symptoms of pregnancy which we consider normal, because when a woman is pregnant, you go through a lot of things. There are a lot of feelings you have, there are a lot of symptoms you have, there are signs you observe, and one very important question in your mind is this normal or is it not normal? Should I call somebody or should I just keep quiet? Should I call my doctor or should I just observe it? So a lot of times you're torn in between. You're wondering if you should be worried or not to be worried. Is this something normal? Now, even for women who have gone through pregnancy before, once they have delivered, they tend to forget all the experiences they had. 6 months, 1 year, and they are pregnant again. They say, doctor, did I have that kind of experience? I can't remember. Even those who had very serious experiences, they say, doctor, I won't do this again. No, I'll stop. 1 month, 1 year after, they are back and like, oh, did I go through that? They have forgotten. All right, so that's why we want to quickly just go through these to ask ourselves these questions. Are my symptoms of pregnancy normal? So next slide. Like I said before, it is perfectly normal not to feel any pregnancy symptoms at all. All right? When a woman is pregnant, she wants to feel so many things. She has read, Google has told her, her friends have told her that, once you get pregnant, you will feel this, you will feel that, you will feel this. And so there are a lot of expectation when a woman is pregnant. She wants to start feeling so many things. So when a woman is not feeling anything and she's been told that she's pregnant, she begins to doubt it. Are you sure I'm actually pregnant? So, particularly for women who go through IVF, like most of our women do here, and they've done their test and they say, oh, congratulations, you are pregnant. And they now begin to expect a lot of, symptoms. They want to start feeling a lot of things. And when they are not feeling it, they sometimes begin to doubt whether they are pregnant. The truth of the matter is that you can be pregnant and not have any symptoms at all. Why you can be pregnant and have a lot of symptoms? It all depends on the patient, because every patient is different. It depends on the number of babies you are carrying, because the way you feel when you are carrying one and the way you feel when you are carrying 2 or 3, they are very different. All right? So that's why you cannot compare yourself with another woman who is pregnant. Neither can you compare yourself with another pregnancy. Every pregnancy is unique. So we say you may not be unaware, you may be unaware that you are pregnant. Don't be scared. But however, if go for checkup if symptoms were present and suddenly they have disappeared, particularly in the first trimester. So what this means is that, you were confirmed pregnant and you were having a lot of symptoms, vomiting, nausea, tiredness, and then suddenly you woke up and boom, you are now perfectly normal. And you are wondering, what could have happened? Yes, if you're scared, you may want to go to the hospital and get checked up, because sometimes there may not be no challenge, there probably will not be any challenge, but sometimes it could be that the pregnancy has been challenged, in which case the pregnancy has stopped, there's probably a missed abortion, the baby has stopped growing, has died. And so all of those pregnancy symptoms you used to have before will all just roll back, and then you start feeling perfectly normal. I will advise that if you were having a lot of pregnancy symptoms and suddenly they've all just disappeared and not one at all, then you may the hospital and see your doctor. Okay, so what is the first symptom that a lot of women have, for which they consider whether it's normal or not? That is it normal or not to feel any symptom at all? Okay, so meaning that I am pregnant, but I'm not feeling any symptoms. Is it? And in your first trimester, you didn't feel anything at all. Let me see your hand up. You didn't feel anything. You were just normal. You were actually doubting yourself. Are they correct? Are they sure? Am I actually pregnant? How many women had that experience? Okay, you didn't feel much. Okay.
Only my breast.
Only your breast. Okay, you felt. Who did not feel anything at all? There was nothing. You were spitting. Okay, nobody. Okay, you all felt something, one thing or the other. Well, those of you who are watching online, maybe you can post something on the remark to say whether you felt anything at all or not. Okay, so it is perfectly normal not to feel any pregnancy symptoms at all. It's perfectly normal. All right, so you can be pregnant and not feel anything at all. And that's how for women who get pregnant spontaneously, 3 months have gone, they were not even aware that they were even pregnant. 4 months. In fact, I don't know, how many of you have watched this program? I think it's on TLC. I did not know I was pregnant. It is when they want to deliver, they now realize that. But I sometimes doubt that. I think that one is just it's a makeup. How will a woman not know she was pregnant for 9 months? So when the baby was kicking, you thought it was somebody playing football in your tummy or what? How will you not feel adding weight? Although some women, they don't add weight when they're pregnant, sha. And there are some women who are already fat, and they just think they're just adding fat. They're just right, but there is no way. By the time you get into your second trimester, third trimester, when that baby starts kicking, you must know that something is happening in there. All right, but it's a program they show. But most women, a lot of women in their first trimester may not even know that they're pregnant. So yes, it is true. Okay. So we said, so next slide. So is nausea and vomiting normal? So how many of you experienced some form of nausea and vomiting during your first trimester in pregnancy? Let me see your hand up. Show of hands. Only one. Wow. So most of you didn't know nausea, no vomiting. Wow, that is good. All right. This again is is it normal? Nausea and vomit? Yes, it is normal. So you vomit and you have nausea in the first trimester. It is common in pregnancy. However, the one that is not normal, which some women may have, is what we call hyperemesis gravidarum. It simply means excessive vomiting. It means you are not able to tolerate anything at all. You can't take anything orally. You take water, you take food, everything you take comes out. For those category of patients, when they have that, they will have to be admitted into the hospital, and then they will have to be rehydrated and given medications to stop the vomiting. All right? So you want to ask yourself, is this nausea and vomiting normal or not? The normal morning sickness, where most times in the mornings you're brushing, you throw up, and that is all for the day, that is normal. Or sometimes it may be in the afternoon or in the evening. As long as you are still able to tolerate meals, you are still able to eat, then there is no problem. But when you get to the point where you are not able to tolerate anything orally, you are always throwing up every day. Anything you take in, you throw up, you are scared of eating, you are losing weight, you are very tired. That is not normal. At that point, you will need to be admitted into the hospital and treated. All right? Then the next one is I am always feeling sleepy and tired. Is it normal? I'm always feeling sleepy and tired. Is it normal? Yes, it is perfectly normal. So it is one of the symptoms and signs of pregnancy. Okay? And this is due to hormonal effects. So again, how many of you during your first trimester you felt tired and you felt sleepy? Just eat and sleep, eat and sleep, eat and sleep. Yeah. So some of you felt like that. Yes. So the hormones of pregnancy is what usually causes that. So yes, you can feel tired and feel sleepy. It's usually in the first trimester, although some women may go ahead to experience that all through their pregnancy, but it's usually more during the first trimester, because once the first trimester is over, then a lot of those symptoms would naturally disappear. All right, so that is not a challenge. So if you are feeling that, then it is okay. All right. So the next one is this abdominal cramps normal? How many of you have ever felt abdominal pains while you're pregnant? Up until now, you felt abdominal pains? Yes, yes, yes. Once. Oh, okay, that's good. One thing that a lot of women feel while they are pregnant, they feel abdominal cramps, abdominal pains, their tummy is paining, then they're feeling some cramps. So the question is, these cramps that I'm feeling, is it normal? Or is it, should I be worried about it? Okay, so most mild abdominal cramps in pregnancy is normal. Okay, it's having cramps right from when you first trimester. For those who go through IVF, when you even have your transfer done, you begin to feel some mild cramps off and on, and then till when you're confirmed pregnant, all through first trimester, you may begin to have some of those mild cramps. They come and then they go. And sometimes, maybe when you take fluids, they probably may be due to dehydration. But as long as you're well hydrated, then all of those cramps would go. But if the cramps become very severe, when the cramps are very, very severe, particularly when they are associated with bleeding and you are pregnant, then that is a serious challenge. So for that, you will have to get to the hospital so that you can be evaluated, because depending on the trimester when this is happening, if it's in the first trimester and you're having severe abdominal cramps and you are bleeding, that could just be an indication that your pregnancy is trying to abort. You're trying to have a miscarriage. So you need to get to the clinic early enough to see what can be done. All right. Now, you can also have abdominal cramps that could be due to uterine fibroids. All right, adenomyosis, abdominal pains, not cramps now, just more severe abdominal pains. And that is usually common when you have when they are having their fibroids are undergoing degeneration. There's what we call degeneration of the uterine fibroids. Okay, so once the fibroids start undergoing degeneration, it's usually associated with severe hospital, giving fluids, giving very strong pain relievers, and then some antibiotics if required in some cases before to be able to manage the condition. Same also if you have adenomyosis. And of course, UTI abdominal cramps particularly will stop. All right. So the important thing for you to know is to know when to raise them. If you are having very mild abdominal cramps and you take a lot of fluid and the pain goes away, then most likely those are the normal abdominal cramps that you will have in pregnancy. But if the pain persists after you've taken a lot of fluid, you've taken paracetamol, then you may need to visit the hospital for further evaluation. All right. I am seeing blood. Is it normal? Hi. So that is one thing that a pregnant woman does not want to see. Two very important things that a woman does not want to see once she's pregnant. Number one, however, it depends on the severity of the bleeding. Okay? Yes, we say it is not normal, but again, there are some bleeding you will have that may not be so scary. For example, when a woman have an embryo transfer done, and during that 2 weeks before the pregnancy test is done, she spots a bit, just spotting, not bleed, just spot. She wipes and she sees blood. Sometimes it may not even be bright red, maybe brownish or so. It could mean that she's having an implantation bleed. There's implantation is going on. So that could be a positive sign. Okay? So if she has that, then she shouldn't be worried. Particularly if it comes and then 1-2 days and then it goes away, doesn't have it anymore. All right? It could just mean that she had that bleed because of implantation. And most often than not, when you do the test, she's confirmed positive. All right? Then when she's confirmed positive and then the pregnancy is going on and she just gets spots here and there, again, that is not a challenge. Particularly if she's not having cramps. If she's not having any abdominal pains and she's just having 1 or 2 spots once and again, no problem. But if the bleeding increases to re-bleed, like she's seen her period, and even increases more, clots are not coming, and then she's not having abdominal cramps, then there is challenge, there is trouble. It could mean, depending on the stage of the pregnancy, it could mean that the pregnancy is being challenged seriously. Probably a miscarriage is about to take place. All right? So for such, the woman should definitely come to the hospital and see her doctor. So no bleeding is normal, but you are able to determine what it's more worrisome than the other. But for all bleedings that occur during pregnancy, you should visit the hospital. And the cause of the bleeding depends on what stage of pregnancy the bleeding is occurring. Bleeding that occurs in first trimester is different from, the causes are different from what would the causes during the second trimester and then during the third trimester. Now, during the third trimester, the two main causes of bleeding, what we call antepartum hemorrhage, is due to the abnormal placentation, the abnormal position of the placenta, what we call placenta previa, or the premature separation of the placenta, what we call placenta abruptio. Those are the two main causes of bleeding in a woman who has crossed 24 weeks of pregnancy. But once there's any bleeding at all, that woman will be admitted, evaluated, and managed accordingly. All right? Okay, so what is the next? My appetite has not increased. Is it normal? Okay, so let's take a poll again. How many of you during your first trimester your appetite increased? Let me see hand up. Okay, 2. How many of you your appetite did not change at all? None. How many of you your appetite decreased? Where are you? Increase, normal, or decrease? You have to be one of them. Normal. So your appetite was normal. It did not increase or decrease. 2 of you, your appetite increased, and then 1, your appetite decreased. So those watching online, I think you also post yours to let us know what it was. All right, so you can see that the appetite can increase during pregnancy. It can be normal. It may not change, or it may decrease. Okay, so that is what you have here. So it all depends. So the fact that there are a lot of women who believe that, oh, once I'm pregnant, because my friend, when she was pregnant, she was just eating everything, her appetite increased, so she was just, and so they're looking forward to that time when they get pregnant and the appetite increases. Yes, it happened for your friend, but it may not happen for you. So you need to know that it is perfectly normal if your appetite increases. It is also perfectly normal if it does not change. It's also perfectly normal if your appetite decreases. It's all based on the individual peculiarities. And there are some people who may now begin to have cravings. All right? Start having a lot of cravings. The things that you didn't like before when you were not pregnant, you didn't like it at all. Suddenly, you now begin to like them. In fact, there are some people that their husbands have looked at them and they thought that this woman has gone crazy. 1 minute she's demanding and asking, oh, it must be this, this, this. They bring it, oh, sorry, but I don't have appetite for it again. It is this one now. He goes and gets it. Oh, sorry, I've lost appetite. You know? So women can have cravings, and those cravings can change from time to time. Today it may just be Indomie. Tomorrow, but she doesn't want to use I to say Indomie anymore. It is now beans. Next tomorrow, rice. All right. Sometimes it may just be he wants to just be eating egg, and that's all. All right. So some women may have certain cravings, and some may never experience any craving at all. So this is what I'm talking about. So some women will say, Doctor, what are you talking about? Me, I didn't experience nothing. I was normal. The food I used to eat before I was pregnant, that's the same food I was eating when I got pregnant. After I delivered, the same food continued. I didn't feel any change at all. It is also possible. And there are those who will say, this pregnancy, eating was a challenge. Even the food I love most, my best food, became my worst food. All of those things are things that you can experience while you are pregnant. Okay? And then lastly, I'm always getting angry. Is it normal? I'm always getting angry. Is it normal? So how many of you noticed that when you got pregnant that you started experiencing mood swing? Any small thing, you just get angry. Your husband will just be getting it. What did I do? He said, so small thing. How many of you manifested that behavior? I know. Yes. All right. So, is it normal? It is normal. Mood swings are common in pregnancy. And why are they common? They are due to hormones. All right. There are hormones of pregnancy that makes women to go through all of those mood swings. 1 minute she's happy, the next minute mood has changed, she's angry, she's feeling depressed. The other minute she doesn't want to see anybody. You know, it's all because of the hormones of pregnancy. That is why the men in the house, thank God we have one man in the house who just so you are representing all the men. And for those who are watching online, all the men in the house, please understand with your wives. They've not gone mental. They've not gone colo. It is just the pregnancy. So when you see them begin to manifest behaviors that are not normal, just know that it is because of the pregnancy. And once they are done, once they've given birth, then they will return to normal. In fact, there are some people whose manifestation can be heightened immediately after they give birth. What we call puerperal psychosis. They don't want to see the baby anymore. If they're giving the baby, they can even harm the baby. All right, call it puerperal psychosis. That is the extreme. There's the puerperal blues where you have some form of abnormal behaviors. It's all because of the stress of the pregnancy process, because of the hormones of pregnancy. So all of those things have a lot of effect on the woman. And if the woman doesn't have support system, structures that support her, and that is why our spouses play a very, very important role during pregnancy to support the women. Pregnancy is not easy. Women, do you agree? Or am I saying the truth? It's not easy. I wish men can get pregnant for once. I can tell you that men will tell you that, see, one is enough. Hey, no. All right? It's not easy. So that's why all the women who are pregnant, they need all the support they can get. And the primary supporter, okay, is their spouse. And that is why no man should tell a woman, are you the first to get pregnant? My mother gave birth to 7 of us. If this is how she was doing it, there's no way I would have come to this earth. No. You don't compare your pregnancy, you don't compare your wife to that of your mother. Every pregnancy is different. Okay? I don't think that your wife is funny. No, some men think that some women they are overdoing it. I know now. You are pregnant now. Nobody will hear what for this house again. And it's not, no. Don't think like that. Okay? Because every pregnancy is different, every pregnancy is unique. And so please listen to your wife when she's complaining and says this is how she's feeling. You know, I say that husbands are the primary doctors of their wives. We are secondary. So you are the primary doctor. Why? Because you are the one that your wife relates everything to. As she's doing her, she tells you. That's why when she's coming to the clinic, come with her. Because some things that she will forget, you will remember. Oh, honey, you remember you told me about this, baby, you told me about this. Oh, yes. I've forgotten. All right? And then a lot of men have given a lot of useful support and advice to their wives. So again, I say to the women, listen to your husband. You know, women sometimes they say, are you my doctor? What do you know? My friend, just stay there. When I get to the hospital, I will ask my doctor. And oftentimes, this is what I've experienced. When they come to the hospital and the woman is narrating and I'm counseling and say, this is what it is, the husband will just be smiling and say, I told you. See, you didn't want to listen to me, Abi, because I don't have certificates. All right? So it's important that the husband, please provide all the necessary support to ensure that your wife is comfortable, feels appreciated, and given all the necessary support. Trust me, that will go a long way to help her emotionally, to help her psychologically, to go through this process and then achieve very good outcomes. All right? Okay, so next is I'm desiring to eat weird things. Is it normal? You know, the people that before they were pregnant, they were very careful about the things they eat. You know, they don't eat, junks, all of those things. But now, once they get pregnant, they want to start eating chalk. You know what they call uzu. I don't know if you know it. They start craving those kind of funny things. Some will say, my crave for alcohol is at another level. Please, just a sip. Hey, alcohol? No. So they begin to have all of those cravings. Is it normal? Yes, it can happen. As long as it is not harmful to the woman or to the baby, no problem. All right? They are all cravings that a woman has. But you see, that thing they call alcohol, no. You don't go there. No matter the craving. Someone will say, see, doctor, you don't understand. It's not as if I want to drink it. Just a little sip Let it just touch my tongue and I'll be satisfied. So truly, and when you give them and you touch their tongue, they're okay. All right. In that kind of situation, those kind of people, you have to monitor them. The husband has to be around, has to take the shot and put it. Like they said in the Bible, let Abraham, you touch, put the hand inside you and put the tongue. So that is what it is. Just put it and she will be satisfied. Because if you don't monitor her, sip can become finish the whole bottle. Okay? So now, why do we tell women not to drink, not to take alcohol during pregnancy? Because it can affect the baby, what we call a fetal alcohol syndrome. Yes, we agree that little sips of alcohol will not affect, but you don't know when little sip become big sip, and big sip becomes you finish the whole bottle. So it's just for ensure that there's nothing. Don't get to yesterday's that touch the heart. We say, please, women, when you're pregnant, you don't drink. Okay? And then some women may have some cravings that changes very quickly, rapidly, okay, for a particular time, and then it changes to something else very quickly. It's all normal. Okay, like I said before, some may have particular cravings for certain kinds of food, particularly for things that they were not even used to taking before. They probably did not even like. But now that they are pregnant, those are the things they are now craving for. Yeah, it's not abnormal, okay? And then you can have it, and then some may not even have any desire or craving at all. All right, so why some may not have any cravings, some may have various kinds of cravings, and some maybe it may be moderate, okay? So all of those are all normal during pregnancy. And then lastly, you have urinating too frequently. Is this normal? So how many of you, while you were pregnant, you experienced that? You noticed that you were passing urine very frequently, particularly at night. You wake up 5, 6, 7 times, and you know that it's affecting your sleep. You get to wake up to go and pee. How many of us? Yeah. It's very common in pregnancy, okay? And it depends on the stage of pregnancy. First trimester, yes, it can occur very frequently, but when the uterus is growing and trying to come out of the pelvis into the abdomen. And then once you get into the third trimester, when the uterus is now pressing on the bladder, then you get to pass urine very frequently, okay? It's one of the symptoms that is due to hormones and then the increase in the size of the uterus. However, if this is associated with pain when you are passing urine or a lower abdominal pain, it is not normal. This could be as a result of UTI. So you will need to be tested to check your urine. First of all, do urinalysis to find out if there is protein or nitrite, and thereafter you do a culture to find out if there's any bacteria that can be identified. If there is, we will isolate and do a sensitivity to know what antibiotics to give to you. And once you take the antibiotics, you'll be fine. All right? So when you start experiencing that you are passing urine very frequently, you need to watch. Of course, when you take a lot of water, what will happen? You will pass a lot of urine. So there are those women who take a lot of water. It's expected that you take water, you will pass urine. But once there is pain, then you need to come in for testing. It's also very important for us to also watch out, because when you have increased blood sugar, what we call diabetes mellitus, one of the things you will experience is that you will start passing urine very frequently. All right, and the urine is usually much. It's large. So that is also one thing that you need to also notice. If you're passing urine frequently, you want to ask yourself, is this a normal phenomenon? Or is it that I'm having an infection? Or is it that my sugar level is high? And that's the reason why when you come to the hospital for your antenatal, one of the things you must do, no matter what, even if you come every day to the hospital, is what? You must check your urine. Oh, I was just breezing through to greet Dr. Abebe. Have you checked your urine? Go and check your urine. Opportunity. Why? Because with just your urine, we can determine if there is UTI. We can determine if there is diabetes. If your blood sugar is high, we can pick it up in your urine. We can determine if there is infection with the high levels of leukocytes. All right. So there are a lot of things we can check just by checking your urine. And that is why it is very important, and it's a very important test to do when you are pregnant because it reveals a lot of things to us. Okay, so these are some of the things that we decided to look at to see if it is normal. And there are many other things that patients feel, but when you are in doubt as to whether whatever you are feeling is normal or abnormal, what do? You call, you come to the hospital. Don't take anything for granted. Don't take anything for granted. For example, you've been feeling your baby's movement. You now have a routine. You know how your baby moves. And then suddenly you just started feeling that, I've not felt this baby's movement since today. Or is it my mind? Then you know that usually when you just finish eating, the movement increases. Or when you take something that contains sugar, the movement increases. And then you take it, and the baby did not move. Didn't move well. What should you do? Come to the hospital. Don't say, the baby is moving. It just means I'm the one that is not feeling it. No. There are certain things that will happen once you are very vigilant and you know how your body works. There are certain symptoms that, okay, this may be not right or wrong. It's better you come to the hospital and we do a scan for you and we say, oh, your baby is, and a lot of times, trust me, that baby just wanted you to come to hospital to come and see our face. But as soon as you are putting the probe, I can feel the baby move now. And the baby and you will see the baby moving, kicking. Meanwhile, all this while at home, baby did not move. All right, so it's better you come to the hospital to check, and you see that baby is fine and everything is fine, your vitals are fine, and then you go back reassured. In-house questions. Yeah, the question has been answered already. Okay.
First trend, I feel hungry. Easy. I eat in 2 hours time. I feel like I need the younger starts. I see if I don't eat.
Exactly.
So but I notice now that I'll eat in the morning and it's me that will tell myself, "Kai, you are not eating. I'll not be hungry."
Yes.
I'll have to force myself. I've heard that it's normal.
It's normal. Appetites can change, during the course of the pregnancy. Okay, so yes, you want to wife. Ask the question. Don't worry. Yes. Okay, so PCV, packed cell volume, is the blood level of the patient. So there is what is considered normal when the woman is not pregnant. Anything from 33 and above it's fine. But for women that are pregnant, they lowered it to 30. So once the woman gets to 30, 31 and above, is considered normal. In those in what we call the high social economic group, 33 and above. So, but generally in Nigeria, anything 30 and above is considered normal. But 30 below, that means the patient is anemic. All right. So it's one thing so that is why, because we know that most women, what you need to maintain your PCV is iron and folic acid, basically. Other multivitamins that are added to other supplements, well, they're okay, but basically for iron production, for your cell, is iron and folic acid. And that is contained in most of all the supplements that you take. All right. So, but we give it to you while you are pregnant because we note that you may not be able to get adequately from the food that you're eating. And so you check it once you register for your antenatal, it is done at 28 weeks to be sure that your levels are 30 and above. Once we notice that it is less than 30, then we can double your iron supplement that you're taking, and that will help to increase your blood level, and then we'll ask you to take more food content like vegetables and all of those things that contain iron, and then that will be fine. All right? No, not like it. Yeah, although there are some very rare conditions where a woman will have very high levels, but that is very rare. I mean, if you are getting 35, it's normal. It only means that you are eating, you are chopping life. You are eating well. Yes. Yes. So basically, for us, we give letters. We expect you, if you are traveling outside the country, I'll try to go and deliver, right? To take a trip. Anything less than 32 weeks, you can travel. Yes, so anything less than 32 weeks, you can travel. All right? But there are certain conditions. You know, women differ. There are certain conditions where a woman will be grounded all through pregnancy. For example, a woman has lost a previous pregnancy, say, for example, due to incompetent service. And so that kind of woman, she should, even though she has a cervical sacrilege, in that pregnancy, she should take it easy. Preferably not do any travel. Just rest most of the time. In fact, there are some patients that they can be quarantined in the hospital throughout the pregnancy, depending on how severe it is. A patient who has had a previous bleeding or bled in that pregnancy, and the pregnancy has stopped, and we have diagnosed placenta previa, that patient should not travel, because she may be traveling and bleeding will start, and it becomes an emergency. Do you understand? So for all those categories of patients, those are exceptions that throughout the pregnancy they are advised to just remain. But if everything has been normal, no incidences at all, then after the first trimester, you can make your trips on or before 33 weeks of pregnancy. Okay? But the way she smiled is like, that question was targeted towards something, towards some hair. So the answer now just says, Somebody has just okay. Any question? Okay. Mm-hmm.
So I felt probably it's normal.
Mm-hmm.
Just let it be, but the next day
So it's just to be observant. In fact, normally sometimes what we do, particularly when a woman gets to 28 weeks, we give you what we call a fetal kick chart to start marking when the baby kicks or moves. So normally what we say is that if a baby is able to achieve 10 kicks in a 10-hour period, then that baby is fine. I'm sure I'm sure you all know that some babies in 1 hour they've done that 10 self. So if your baby has achieved that in 1 hour, then you have signed up for that day. That baby is fine, no wahala. Then till the next day. All right? Yes. To start experiencing the movement, yes. So typically, it depends on whether you're a first-time woman who is getting pregnant or you've gotten pregnant before and delivered. Because sometimes the baby may be moving, but you're not aware. So typically, if this is your very first time, we will say give it up to about 20 weeks before you can really begin to experience. But if it's your second time, sometimes you may begin to feel it earlier than 20 weeks, sometimes 16, 18 weeks. You can begin to feel the baby move where you can now begin to notice. But the real kicks that are noticeable is towards the later end of the second trimester to the third trimester. All right? Do we have any question from our online audience? Okay, there are. Okay, someone says, I'm still feeling abdominal cramps. So, okay. So it now depends, the cramps you are feeling, what is the intensity? Is it mild or severe? So for patients, like I said, for patients who are feeling abdominal cramps, see, a woman who is carrying 2 or 3, depending on the trimester, you will feel cramps off and again. So for those women, I tell them, take a lot of fluid, don't be dehydrated, and take paracetamol. All right, it will help. But if the pain becomes really severe, because you want to be able to differentiate just mild cramps from contractions. All right, even when you're having what we call the prostate contractions, they're usually not painful. Okay, just a bit of discomfort. All right. So you would those are normal. But when you start having painful contractions, like those who have painful periods, pain higher than that, then that you need to come to the hospital. All right. My legs are swollen, especially when I'm sitting down. Please, what is the problem? And what can I do to reduce it as I'm 27 weeks going to 28 weeks by next week? There is no problem. Your legs are swollen, it's called pedal edema. There is no problem. As long as your blood pressure is normal and there is no protein in your urine. Okay? If there's no protein in your urine and your blood pressure is fine, then your legs are swollen. A lot of women who are pregnant, they will have swollen legs. Okay? So what I advise you to do is that when you are sitting down, you can raise it up on top of a pillow, or when you are lying down. All right? But if your blood pressure is elevated, you're having hypertensive disorders in pregnancy, whether it was induced in pregnancy or you were hypertensive before you got pregnant, then we need to watch it. All right? Then we need to monitor your weight to be sure that you're not gaining excessive weight as a result of fluid accumulation. All right? So we'll monitor your blood pressure and then we'll check your urine to be sure that there are no proteins, and then we'll monitor accordingly. All right? Was that all the questions online? Okay, so any other question? No? Okay, so I want to once again appreciate every one of you. Today we started on time. No, today we don't do African time. We do English time. So those of us who thought that, no, this one, they said 2, but they will start by 3. We started by 2. So please, let's come on time so that we can start. Because as at 2, we already had our online audience that were already on. So we didn't want to keep them waiting. So I want to believe that we gained some knowledge today concerning things that are to be considered normal and what to do when you are not sure. Get in touch with your hospital and then you get checked up. All right. So I want to wish all of our pregnant women a very safe delivery. To wish you continued uneventful antenatal care. All right. And then I believe that everything will go well. So we'll be having our last antenatal class for the year. The first Saturday of next month is what date? So that will probably be seventh. Okay, good. So that is when we will have our last antenatal class for the year. For those who would have delivered before then, I wish you congratulations, and then we look forward to having your babies. And for those who are just starting the journey, don't worry, very soon you will get there. Okay? You know, matriculation comes at different times. Somebody who just matriculated and someone who is in year 5, you cannot be comparing yourself. So now say, hey, oh, I wish. No, don't wish. Enter and do your own level. You all graduate. That is the assurance. Okay? So have a wonderful weekend. And then please make sure you attend your antenatal clinics, ask questions, make sure you do Vital signs, do your urine. Some of you may be in the habit of dodging urine. You pee before you come. Oh, pee. Oh, sorry, I don't have urine. And then, no. It's for your good. Make sure you do your urine test. It's all very important. So have a wonderful weekend and God bless you. Thank you.